I'm joined now by Dr. Whitney Goldner, who is the chair of the Clinical Endocrine Education Committee. Thank you so much for being here. We're talking today about the maintenance of certification for ENDO 2016 and some of the changes that have taken place.
Yes, so there's actually been quite a few changes over the last few years, and sometimes it's hard to know how to get MOC or maintenance of certification points. And so the Endocrine Society has been working hard to kind of keep the members informed about how this can happen and also to help provide them opportunities to get additional maintenance of certification points while they're here at the meeting.
Because clearly members want this, but the criteria, I think, can be so confusing. So how do these new guidelines help?
Right, you're exactly right. It can be confusing because recently the American Board of Internal Medicine and the American Board of Pediatrics have kind of changed what they think could be eligible for MOC points. So fortunately, many of the activities that we are already doing to get CME points or continuing medical education points will now be available for both CME and MOC points, and we're thrilled to be able to offer some of that here at the meeting.
And I think the Society has always tried to be very supportive in this. And there's always been a focus on maintenance of certification points, but it's changed just a little bit this year.
Right, so for years the Endocrine Society has offered MOC points to practitioners, but what's different this year is we're now going to be able to offer MOC points for some of these live events. So there's actually about 40 sessions that will be eligible for MOC points. Now any individual attendee can get either 11 ABIM points or 10 ABP points. The difference is with the ABP or the pediatric points is they need to attend all of the sessions, but it's a great opportunity for people who can go to those sessions.
Okay, you touched on the points they can get, so I guess the critical question now is which they can and how do they monitor everything that they're doing to make sure they get credit for the points?
Right, that's a great question because not every session is going to be eligible for MOC points. So it's important to look at the app and look at the program to see which ones would be eligible for MOC points if you are wanting to get those MOC points. And then the sessions will be slightly different in that there will be ways to kind of pre-test yourself, learn the material, and then have kind of a answer to the questions throughout the sessions, which would be MOC type activities that have been approved by the societies. So they'll be structured slightly differently, but they will also be eligible for these MOC points.
Okay, so if you had to choose a strategy for people, look in the book first to figure them out, and then from there go to figure out which ones actually count.
Right, exactly. And then when you go to fill out your meeting evaluation, just like we do for CME points, you can then also get the credit for the MOC points for the ones that actually provide MOC and CME points together.
It's so critical and it's so nice to have that level of support. Thank you so much.
Thank you.